Hello people, in this video we will explore the anatomy of the stomach. We will talk about syntopy, meaning its relationship with nearby structures, and then gross anatomy. Before jumping over to the anatomy of the stomach, we can mention some important points. It is the widest part of the gastrointestinal tract, with capacity of approximately 500 ml to a maximum capacity of 3 liters. It is a J-shaped organ and it is 25 centimeters long. The stomach contains ingested food that is mechanically and chemically changed to a chymus, which is a semi-liquid. Okay guys, now it's time to speak about the position and its syntopy. Stomach is an intraperitoneal organ, meaning it lies within the peritoneal cavity as you can see in this image. It is located below the left dome of the diaphragm and is above the colon, so it's in the supracollic part of the abdomen. The fundus of the stomach, as you can see in this picture, is near the left lung through the diaphragm. As we said before, stomach is an intraperitoneal organ. Anteriorly, meaning on the front of the stomach, it's related to the left lobe of the liver, and posteriorly, meaning on its back surface, is related to the left kidney along with its suprarenal gland, the diaphragm, the spleen, the transverse mesocolon, and the pancreas. Anteriorly on the abdominal wall, the stomach projects on the epigastrium in an area called the triangle of Lappe. Okay people, at this part of the video, we have made clear where exactly the stomach is located. Now, it's time to go through its anatomy. We will start by going through the external features of the organ, and afterwards we will proceed to the internal anatomical features. Stomach, as we mentioned in the previous part of the video, has anterior and posterior surfaces. On the lateral part, meaning the point away from the midline of the body, it is the so-called greater curvature. It is 4 to 5 times longer than the lesser curvature, which is located in the medial part of the organ, which means towards the midline of the body. The angular incisure or the angular notch is located on a point between the lesser curvature and the pyloric part of the stomach. It is a separation point between the gastric canal and the pyloric canal. The fundus of the stomach is the superior part of the organ. It is the widest part of the gastrointestinal tract and is 4 to 5 centimeters wide. It reaches the 5th to 6th left rib cartilages. The cartilage of the stomach is located at the level of the 10th to 11th thoracic vertebra and marks the gastroesophageal junction, forming the dentate line in the interior, which is the part where the two epithelial meet. The cardiac notch separates the fundus from the cardia. This part here is the body of the stomach, and it runs inferiorly, meaning downwards, and medially. The pyloric part of the stomach is the distal part of the organ. In between the body and the pylorus is the pyloric antrum. It is found at the level of the angular notch. The pyloric canal is 2 to 3 centimeters long and is heading towards the pylorus. It is a transition between the stomach and the duodenum, and it has a pyloric orifice. Moving to the last part of this video, we will go through the internal parts of the stomach. The esophagus meets the stomach through the cardial orifice. It forms the Z-line or dentate line. The fundus contains the swallowed air, forming the stomach bubble as you can see in this X-ray. The wall of the stomach is composed of 4 layers. The innermost layer is called the mucosa. It has the gastric folds, which between them are formed the so-called surculus salivarius, gastric glands opening into the gastric pits. Below the mucosa is the submucosa. Below the submucosa is the muscular wall, which is composed of 3 layers of muscles. The innermost are oblique fibers, the middle are circular fibers, which are the pylorus make the pyloric sphincter, and in the cardiac, the gastroesophageal sphincter. The outermost are the longitudinal fibers, which are found at the greater and lesser curvature. The outermost layer is called the serosa, which is the visceral peritoneum. Okay people, after going through everything we need to know about the anatomy of the stomach, here's a question. The muscular layer of the stomach does not have inner oblique fibers, middle longitudinal fibers, middle circular fibers, or outer longitudinal fibers. You can put your answers in the comment section below. Okay people, this was the end of the video. If you found this video helpful, please hit that like and subscribe button and let me know in the comments below if you have any questions or any suggestions.